pain is not just physical. It's a psychosocial problem where it's not just the physical trauma that caused you to have pain. You can still be having the pain, but your mindfulness technique can help you make it tolerable. As you might know, the Room Doc, we are focusing more on autoimmune disease, rheumatoid arthritis, but in general, mindfulness is found to be helpful in a lot of other chronic conditions. So let's get a little more clarity from Dr. Dubal, based on her practice of medicine, how mindfulness connect with medicine and then chronic diseases.
It is absolutely fascinating. There has been a lot of research done about how practicing meditation and mindfulness daily can help decrease your blood pressure. It helps controlling asthma, eczema, autoimmune diseases like rheumatoid arthritis. It helps with pain of fibromyalgia. And personally, I had experienced chronic pain for many years. I suffer from migraines since I was a teenager. And also I was in a car accident about in 2007 and broke multiple bones and have a permanent disability from that.
Wow.
So I deal with chronic pain all the time and I don't tolerate the pain medications very well. So mindfulness and meditation have been kind of my go-to help for dealing with my pain. It's amazing to see how it works. The pain doesn't really go away, but it helps you live with the pain with much more space and openness and happiness.
Absolutely. Now that's a very important point to stress on. So pain is not just physical. It's a psychosocial problem where it's not just the physical trauma that caused you to have pain. A lot of the pain signals, when it goes to your brain is what senses most of your pain so that you can modulate how you are feeling the pain. That's what Dr. Dubal is mentioning about. You can still be having the pain, but your mindfulness technique, some of the other technique we'll be talking more, that can help you make it tolerable. Let's hear from Dr. Dubal what she is doing every day to handle those pain, including fibromyalgia pain.
Pain plus resistance is suffering. Pain alone is not something that is bad for you, but when you resist it, it causes suffering. That means, oh, my foot hurts. And the next thing my mind goes to, oh, I have a long day of work. How am I going to do this? Tomorrow I have this other thing planned. Now what am I going to do for that? My day is ruined and I have to take medication, but I'm not going to be able to take certain medications. So our brains ruminate on those things. And when you are able to pause with your mindfulness to stop those stories, stop that resistance and be with your pain. That doesn't mean we have to like pain. That doesn't mean we want pain. That doesn't mean that we want this pain to stay. It's just accepting the fact that the pain is here. And then if you accept and pause instead of resisting it, then what it does, it helps you discern in that moment, what is really going on right now? Am I just ruminating, making up stories in my monkey mind that is making me more miserable about potential future problems? But right now I'm okay. I have some pain. What can I do to help myself? Do I need to take some Tylenol? Do I need to take another stronger pain medication? Do I just need to stop rushing and sit down, have a cup of tea, and just sit for 5 minutes and center myself, regulate myself from sympathetic to parasympathetic, and see how the pain is? So we are definitely not saying that don't take your medication. Pain medications have their place in chronic conditions and diseases, and a lot of us benefit from us. I have to take my medication as needed. But again, I am not taking it without thinking about it, just because I'm afraid what's going to happen tomorrow or tonight with my pain right now. So just stopping, pausing, paying attention, where's the pain? What level is my pain? And what is my body telling you? What do I really need in this moment? And that helps us make wiser choices in our life.
Thank you so much for being so honest and open what you are suffering and how you are dealing. So we have talked a lot about what is mindfulness, how we can apply mindfulness to our regular practices in general, as well as those of you who are suffering with multiple autoimmune and chronic condition. But as you go to internet, as you start Googling or searching, you will see a lot of information. And unfortunately, a lot of them are not true. Let's talk about some of the myths that is out there about mindfulness.
So mindfulness is not something that is very hard to practice, something that is weird, something that only certain people can do, or you have to be a monk, or you have to be a priest to do that. Those are all myths. Everybody, all of us can practice mindfulness, and it is the tool that is a gift to our human species. And I think there are a lot of misconceptions that you have to sit in a lotus position and you have to sit upright and you have to close your eyes and you have to be a certain way. And all of that is just too critical and very narrow definition of how to achieve the mindfulness and meditation practice. The most simple mindfulness practices are just you can just sit every day in your pajamas, lay down in your bed or sit in your bed wherever you're comfortable, close your eyes or down gaze and just focus on your breath for a minute or two to start with. And then you can gradually have longer time periods as you practice more, but you don't really have to wake up at 5 a.m. every morning and be a monk and sit in the lotus position and then sit for hours and hours.
Okay, so you don't have to wake up at 5 o'clock. That's the best news, right? So you can even, before you go to bed, maybe that might be a good time that works for you. Even during the middle of your lunch hour, you can do some mindful meditation and you don't have to sit for hours. Few minutes will do the trick. So don't get discouraged if you cannot sit for a long period of time. Start slow. Start with few steps. Start with few minutes, and then you can slowly, gradually, you can increase your time. And then a lot of my patients, they do come with a lot of anxiety, depression, and they say, oh, I'm very anxious. I cannot meditate. I cannot be mindful. How can I be mindful if I have a lot of anxiety? What's your response to those patients?
Anxiety is nothing but a form of fear, because when you are thinking about future all the time, that's when you end up having anxiety. When you are stuck in the past a lot, you end up having depression, just to make it very simple. So when you are in the present moment, whatever you are thinking about or worrying about is not really there. So if you're able to bring yourself back to your present moment, you are not going to feel as much anxiety. You're going to be able to clear your mind and realize that, oh, yeah, this is what's happening right now. And there might be consequences that might be grave or not so grave, but right now, I'm okay. So just coming back to the present moment, being mindful and practicing that helps us not get carried away in the future worries.
Now, let's switch our gear a little more and we'll talk a little more about the mindfulness, but let's focus back on you. Like, tell us a little more about yourself, your journey so far, your practice of pediatrician, now in the different settings. So tell us a little more about how you are doing, how are you spending your retirement?
A couple of years ago, I decided that I want to deepen my practice. So I planned to become a meditation teacher, and my intention going into the training was to deepen my own practice. But the way it helped me so much that I had very clear information that I need to spread this information. I need to tell about this to others. And if we can use that in our practice, in our daily practice, the quality of life is so much better.
Yep. That's the point, right? What we do as a doctor or any other practitioner, we need to improve the quality of life of ours and the quality of life of our patients. Now, as we say, you cannot pour from an empty cup. So as a healthcare provider, we have to fill our cup. And one of the way of filling the cup looks like the mindfulness and the meditation. How we can use the concept of mindfulness for healthcare providers, how we can be mindful to our patient, how we can be present with our patients.
Unfortunately, the way our medical system is in the United States, we are forced to move really, really fast. And nobody has time, no provider has time to spend with patients. And most providers actually enjoy spending time with their patients, but the system does not allow you to spend more time. So what we can do is using the mindfulness and being focused on what is it that I really want from this interaction with my patient. And before going into each next patient's room, I would just pause, center myself, take a breath, and then go in. Just a small act of pausing was very helpful in being able to be more present and not just looking at my computer or writing notes, but actually continuing to engage with my patients and their parents. And that did end up having me to do more work at home as far as charting goes, but I still was feeling very fulfilled, which was more important to me.
Yeah. And based on my own personal experience, I used to feel the same way when I was practicing a couple of years back. Now, thanks to the AI, which I use it every day, the AI helps me do the charting so that I can be truly present with the patient. I don't have to write the notes. I don't have to get distracted with the EMR. That has been a blessing so that I can truly be present with the patient. Whatever they are sharing with me, I can grasp all of those details. I can truly connect with them. And that also helped me connect with them so that whatever treatment decision we make, they truly understand those and they truly follow those instructions. So that has definitely transformed the whole way how I practice medicine these days. So that is one of the blessings that I feel that the AI has given me is
Blessing of the technology.
blessing in disguise. So it has truly given me the time that I can stay focused with the patient. So that is blessing in disguise for us. Now, Dr. Dubal, do you want to add few practical tips to be mindful?
If you miss your meditation practice or if you forget, it's okay. Be kind to yourself, be gentle to yourself, and there's always next day.
Now, can you tell us, our audience, how they could connect with you?
You can reach out to me at my website, niralidubal.com, and you can send me a message to connect, and I'm happy to help you answer your questions.
For all those audience who have been watching us, listening to us, thank you so much for your valuable time. I hope it was helpful. To get more information like this regarding mindfulness and other techniques that can help you deal with your chronic condition, including rheumatoid arthritis, please like and subscribe. And if you have any other comment, please put them in the comment below. Let us know what type of practice you are doing to be mindful and how it is helping you and how it is changing your life on how you manage and treat your rheumatoid arthritis. Take care. Bye-bye.